far as the coronavirus outbreak for this day, Tuesday, the 28th. We're going to begin first with a word of memory for one of the many people that have died because of the coronavirus. State Supreme Court Judge Steve Milligram of Orange County, who represented the 5-county area of this 9th Judicial District, passed away for COVID-related illnesses. Steve was just elected to this post last November. We had a chance to see him out on the campaign trail, get to know him. Those of us in Westchester County, as well as elsewhere, he won a large victory for what would have been a 14-year term. But now, barely 14 weeks into his tenure, we've lost him. So we grieve for him and for his family, for all the members of the court family, which is a fairly close-knit group of people who serve in the State Supreme Court, County Court, Family Court, and all of the municipal courts. We see that this disease knows no boundary of age, no boundary of ethnicity, no boundary of geography, no boundary of religious affiliation, no boundary at all. And that we lose people of all sorts throughout the course of time, and people that we know and people that we respect. It's been a number of weeks already since I mentioned words of memoriam for Glenn Bolito, councilman from Eastchester. And with each passing day, we have more people that we lose and people that mean something to each of us. But for Judge Milligram, we take a moment of remembrance, and we hope that he rests in peace. As we begin our review of our status, I think it's important to remember that this health crisis is at its core a crisis of individuals and families. We do well to remember that that is the human element that involves in everything. So we can talk about statistics, we can talk about strategies of what we're trying to do to deal with it, testing, and the things we're going to talk about today, how we're going to handle the economy. But we have to first begin with the human reality that this disease has killed many people who were friends and neighbors, and the failure to show that compassion is to not understand what these roles of leadership and responsibility are. At the end of the day, it begins with the human element and the human people that we know and love. The reports today show that we have in Westchester County 28,245 people that have tested positive for coronavirus over the course of this outbreak. However, because of the number of people that have passed the 2-week mark without incident, we have active cases, 8,054 cases. That's a significantly smaller amount than all of the people that have tested positive. 8,000 of those cases are people that have been tested positive and are within the 2-week period of the incubation of the disease. And that's very important because that active number of cases of 8,000 now dips below where we were a month ago. And it definitely shows that we have flattened the curve and we're now slowly on the downside of the curve. Number of active cases is one indicator. Another active case is the number of people that are hospitalized. Right now, we have 868 Westchester residents that are hospitalized for coronavirus in varying degrees of severity. We had 1,200 individuals hospitalized a few weeks ago, so that number is coming down. Neither of these two numbers have come down dramatically. I'd love to be able to say we had 200 active cases and 50 people hospitalized for this, but we're not quite there yet. But I think it does indicate that the things that we've been doing, the steps that we've been taking, and frankly, the sacrifices that have been made by individuals, organizations, groups, businesses, has a positive impact. If we hadn't done these things, I would expect these numbers would be significantly higher. We'd have even more fatalities and even more people in compromised situations. But to have a relative decrease in active cases and a relative decrease in the number of people hospitalized are good news, and they continue to affect day to day. The bad news that continues to affect is the increase in deaths. We now have 983 people who have died, Westchester County residents, from COVID-related illnesses or directly from COVID. And 983 is an increase of 21 over yesterday. Yesterday's number was an increase of 16 over the prior day. So we're appreciative that the numbers aren't 50 more a night or 75 more a night. They were higher a couple of weeks ago, but at this stage of the game, every fatality is a tragedy. At 983, we near the mark of 1,000, which we may hit tomorrow, and it's a sobering, dark milestone. We hope that we could get through the night without losing anybody. The fatality rate is about 3.5%, and that's the number of people who have died versus the number of total cases total positives that we've had altogether. So positives do rise. The number of deaths also rise. The percentages remain static or fall. The percentage of hospitalization rate is at 10.5%, which is a little below the maximum in the 11% range. And again, as we constantly say, we're appreciative that that number is not higher because it would tax our medical systems more severely. We have a sufficient number of beds. I think we worry about a little bit more now the number of ICU beds, because when people get to an extreme situation of need, it's not enough just to be in a hospital or in a hospital setting, but they need to have the added benefit of the ventilators and the other equipment that comes in an ICU setting. But those are the numbers as they stand today. 8,054 active cases, 983 deaths. We have tested 89,144 people. And if you round off the population of Westchester County to 1 million people, then the percentage is easy to figure out. We have tested 8.9% of our population. That number of testing is higher than most every place else you'll hear about. You'll hear national stories that the nation has tested 1% of the population, which is striving to get to 2%. In Westchester County, almost 9% of the people have been tested for COVID and found to be either positive or negative. Now, if you get a negative, you might subsequently be exposed to the disease and become a positive. You may be positive, but then you go through the incubation period and you come out on the other side. And while you're positive, you're not in an active case situation. So there are parameters, but to have tested almost 9% of the population is certainly significantly better than our neighboring jurisdictions within the state. And I would suspect our neighboring jurisdictions for most of the United States. That number is an important number. We had made comparables with Nassau and Suffolk County. Both of those counties now, which are larger than we are, have surpassed us in total number of positives. They surpassed us in total number of deaths. We continue to lead them in the percentage, the low percentage of numbers of positive of everybody tested. We test now at about a ratio of 31%, 32% people positive out of everybody tested. Both of those two counties are in the upper 30% range of the number that are positive out of the total. The lower the number of positive tested, the better off we are in the scheme of things. Yonkers has 5,000 reported cases of coronavirus, New Rochelle 2,149, Mount Vernon 2,067, the town of Greenburgh with its villages 1,587, and White Plains 1,270. Those are the 5 largest communities. They're the 5 largest incidents of COVID infection. Portchester Village is 850, Ossining Village is 792. They represent the next 2 on the list. And at the bottom of our list, we're very happy that Pound Ridge has 18 cases, only 18 cases, and Buchanan Village only has 28 cases. Those are significantly below most of the other communities that fall somewhere in the continuum of the biggest cities and smallest communities as a range. We want to mention in terms of testing that antibody testing will begin at Westchester Medical Center. We expect this week, and the county government is working directly and closely with the leadership of the medical center to make sure that our first responders in essential roles get those antibody tests early on. We want to know that our police, our fire, our EMS, our healthcare workers, other people in public contact positions are in a position to know that they have these antibodies and have cleared and can feel more comfortable in interacting with the community at large. This is true for our correction officials, our probation officials, and so forth. But this is not just Westchester County government. This program is going to be set up and structured, and we're going to coordinate it through the county with all of our different municipal governments. So whether you're Yonkers, Mount Vernon, White Plains, New Rochelle at one end of the spectrum, or Buchanan Village and Pound Ridge at the other end of the spectrum, each individual is going to get the opportunity, each community is going to get the opportunity to have their first responders tested. We're going to try to drive through as many of those tests as possible. We owe a debt of gratitude to Governor Andrew Cuomo. It's his administration that's prioritized this, did the initial negotiations with the Westchester Medical Center, and made this possible. And we think this is, part of the path out of this is going to be through antibody testing and knowing which people in which key positions can interact with us because they have passed through the virus as is necessary. We constantly are dealing now with this, in essence, new concept of social distancing. Social distancing is not something that was part of our culture as society until, slightly less than 2 months ago. Our county police are trying to enforce the rules for social distancing, which are in effect, but we don't believe that enforcing it with the heavy hand of the law will succeed. But we do think it involves interaction with people. Sometimes they're not happy to be told that they need to social distance, and they look for a reason to be argumentative. But by and large, we're getting good cooperation from individuals. And whenever someone sees a large group of people, It is perfectly legitimate to call our county police department, indicate what they see, and if it's within county jurisdiction, we'll act. If it's within local jurisdiction, we'll pass it on to the local governments to act, to try to break it up. A line that I've heard hanging out on the corner once upon a time, a police officer would come by, boys, break it up. Same basic concept. Friends, follow common sense rules. If we follow common sense rules, wear a mask, have a mask at the ready in case you run into somebody and you need to protect yourself and they need to protect themselves from each other. That's really what the mask does. It protects, when I put it on, it protects you from me. When you put it on, it protects me from you. And that's why we all have to do this, not just some of us. And to follow these good, practical, common sense practices, we've been talking about washing our hands, sanitizing our hands, wiping off the surfaces that we constantly touch, doorknobs and keys and keyboards and ATM machines. When you pump gas at a gas station, all those different locations and places need to be sanitized before we interact with them. But just to repeat, on antibody testing, we'll be starting with a schedule for first responders all across the county, and the social distancing is part of the interaction between some of those first responders and our population at large. I want to give a reminder, we've mentioned this more than once, but our Office for Economic Development is in the process of working with Volunteer New York to help small businesses apply for SBA loans, PPP benefits, payroll protection program benefits through the Small Business Administration. All of this was created in the most recent stimulus package, and when the next one went through after that, it put more money into the funds. There's a public policy debate about who's getting the money and so forth, but from a local standpoint, if a local business person operating a small shop is looking to access this assistance, they should contact us. Bridget Gibbons is the contact person, but go to the website Volunteer New York, all one word, Volunteer New York spelled out .org/VVC. And they'll have a chance to see exactly what the program is about in terms of helping you and going from there. It's all very important. Also on the economic development front, our Office of Economic Development has conducted a survey of businesses. It was sent out through chambers of commerce, many of the major business associations, to get a sense of what the economic impact is through all of these different protective individuals, all these individuals rather, who are impacted by the economic realities to their businesses. Of the survey so far, some of the key takeaways: 58% of the businesses surveyed say that they will lose 75 to 100% of their revenue as a result of COVID. 58% will lose 75 to 100% of their revenue as a result of COVID. That is a dramatic economic impact, and that will certainly, create havoc in the small business community, is creating havoc. More than half of the businesses in the survey were from retail, personal services, administrative, and professional services. 60% are either solo entrepreneurs or businesses with less than 5 employees. 85% of the businesses who respond need financial assistance. 64% are applying for SBA loans, and 39% need help with the application process. That is where we are trying to be helpful as a county government in the application process. 29% of the respondents report an annual gross revenue over $1 million, and 25% of the respondents show that their annual gross revenue is under 100,000. And that's a very broad spectrum: 29% at $1 million, 25% under 100,000. The majority of residents do have some the majority of respondents do have some part-time employees, and for some business, this represents the majority of their workforce, part-time employees. 65% of the businesses surveyed have been in business for more than 10 years, so they are definitely part of our fabric of Westchester County. 70% of the businesses need help addressing a changing business model or marketing to help keep customers and clients. They're concerned with the immediate situation regarding cash flow, rent, paying employees, trying to figure out how they can continue. But there's also now a new changed world in being able to identify the people who will buy your product or service going forward, and how the business is going to have to change in this climate in order to be successful. Businesses are looking to their chambers of commerce or business organizations for information, and also for advocacy for state and federal programs, help with marketing and promoting the businesses in the community, networking and connection with one another, and where they can help. And then finally, our work in our Office of Economic Development has to help connect them to resources, keep up-to-date information, conduct webinars, help with applications, grants, or incentives. So very helpful survey. We still are looking for additional responses, and we'll adjust the numbers accordingly. I'll give you an update on these things, but our economic development activity has to follow doing things that matter to the business community, not just creating what we think is important, but listening to the business community and responding to the business community, and particularly the small business community, which we think is very important. And then I want to finally just touch on a very difficult topic to talk about, and that is fatality management. The fact that we have as many people who have died over the course of these 2 months taxes the normal system of how we handle passing on of individuals. On any given night, normally, we might lose 10 people, maybe 12. We certainly don't lose 50 or 60, and we certainly don't lose 1,000 people in the space of 2 months. That is a number that just taxes our system in every point of activity. It impacts the cemeteries and those facilities that provide cremation services. It affects the funeral directors, the funeral homes. It affects the hospitals and the nursing homes where the individuals may have expired. And given the fact that there's an overlay of the death related to COVID, there is still an infection potential that exists for the person that's working with the deceased person. So it's very difficult. The county has been trying to provide effectively PPE, personal protective equipment, gloves, masks, et cetera, gowns, and then also hand sanitizer to all of these organizations. We have also obtained temporary morgue services, which is a bit gruesome, and so I won't be too specific in details, but the ability to protect the remains of the individuals prior to burial or cremation is something that we're trying to address and handle. We're told the capacity at these different locations are taxed, that they're up to maximum numbers. And of course, there aren't any wakes or graveside services at this point in time. We want to avoid that kind of combination of people. So it makes a very difficult environment. Our funeral home directors and the rest of the staff in these funeral homes are in uncharted waters, as are all of us. And yet they have to provide some dignity for the departed and some sense of closure and connection for those of us who remain behind. Joan McDonough from our team is working on these issues. They're not easily resolved. It's not snap the fingers and things start to happen. And we are working with very professional funeral directors, very professional funeral home operators who have not seen anything of this volume anytime recently, but understand how the system works and knows what you can and can't do in order to adjust the system to make it respond to the higher demand. Obviously, we hope to reduce the demand, and that would be the best possible way to resolve that issue. So with that, that is our update for the day with a few specific issues. Some of these will continue going forward. We continue to highlight what we did yesterday, which is that there's now a two-tiered property tax protection element on hand. So the individual who may be watching this and says, what is it? How do I benefit from it? Call your local tax office in your city or your town. They'll explain it to you. And if you believe that you warrant it, then you can apply for an extension. In essence, it's what it is. And that will keep you tax-free until July 15th in order for you to catch your breath and go forward. So Catherine Chaffee is off mic. We'll turn to her, see if any questions have come in from the press. Catherine?
Yes, we have a few questions. First question is from News 12. There is a report that a number of companies based in Manhattan are looking at leasing space for their employees in Westchester, at least temporarily, because of our employees live in Westchester or nearby. Do you know of any Manhattan-based companies that have been in touch with the county looking to lease space?
I don't know of any specific companies that have inquired, and I would say as a matter of courtesy, if there are general inquiries at this stage of the game, we probably would not share that publicly because the business is merely trying to assess what options exist without having to make any kind of commitment. But I'm not aware of them. I do know that I heard this in a group roundtable meeting we had, Zoom meeting that we had last week, 2 weeks ago, with various developers, that is a desirable thing to do when you're in a Manhattan setting and there's congestion and there's really no way to move your people in and out of the borough easily or comfortably without there being a complete lack of social distancing on the subways, on the streets of Manhattan, that the suburbs become attractive as they were back in the 1960s when a number of original major companies left New York City and came here. We had a steady stream of them through the 70s. And then, of course, corporate reorganizations being what it is, not every company can stay in a particular location. But we think that both the office space and the quality of life here is something to attract individuals to come into Westchester County. And we think we're going to see a lot of play along those lines. But I don't have specific names of company A or company B that's looking to do it. I do understand that we're fielding more inquiries now than we've had in recent memory. And, we're happy to welcome new people to come into the county and give it new vitality.
Okay, the next question comes from the Patch. Let me just pull it up. They would like to know if the county will be hiring tracers.
We've yet to figure out with the state exactly how the state is going to implement their plan. If it falls to us to take on that responsibility, we will. In a sense, we've been doing that function from the very beginning with our Department of Health personnel, but clearly we don't have enough people within the county government structure to do that, and we'd have to go outside of it. But I have to defer it until I understand what the state strategy is as they lay it out for us. This is what they're planning to do. Will there be reimbursement or any revenue stream to go with it? I mean, they're in the same boat that we're in, as every town, village, and city is in. We're all in dire straits looking ahead at significant loss of revenues, sales tax, hotel tax, and so forth. So we're not sure how the financial side of it will work. We certainly understand the need for this, and we certainly are willing to help participate directly or as part of a larger team in order to accomplish it. But at this moment in time, I don't have any specifics that you could hang your hat on.
Okay, the next question is from the Journal News. So with the warm weather on Saturday, based on your observations, how do you think people responded? Did you see masks and social distancing? Also today, because of the Blue Angels, reports of a lot of people at Kensico Dam, does the county have people there enforcing, and could this be an issue being it's so crowded?
Well, first of all, there are people at Kensico Dam. There are people at all of our parks. That's what they're there for. I think observing cars or observing that there are a lot of people in a location is not the same as observing whether they're maintaining social distancing or wearing a mask. Over the last 5 weekends, I've fielded any number of complaints that people have made. And when I press them, not to be difficult, but to make sure that they can track us, do you have a picture of what you saw? No, I didn't take a picture of it. What did you see? I saw a lot of people there. They were too close together. What time was it? I don't remember. I've traveled around and seen most of the parks almost every single weekend. I don't do it on the rainy days because I assume that's going to, deter turnout. But I observed in the main, most people observing the proper practices. Now, we didn't have masks as part of the protocol in the beginning of this process. That has evolved in the last week to 2 weeks. And so I am watching more people with masks now. And I've remarked from time to time whether I see some larger or smaller number. It really differs. Depends on where you are, what time of the day you are, and what you're seeing. You're seeing mom, dad, and 3 kids. That's a nuclear family. That's very different from seeing, 10 or 12 teenage kids who are just, bored and out together, socializing as teenage kids will. I don't think that we have a massive problem, but I think the problem does exist. And I think it exists in moments and then it disappears. You look at any open air, if you sit, and I've done this, you sit for an hour on a bench and you observe an open area, you watch the comings and goings of people. And I can assure you that over 60 minutes, for at least 50 minutes, there's no particular moment at which you could say there's too many people there that are too close together. But intermittently, and maybe for 2 to 5 minutes at a piece, you'll see some clustering of people, and you might see that is not hitting the mark in terms of the number of masks, which in theory should be everybody, and then also the social distancing things are not into effect. So I think it's a test of practicality. There are people in the society that hold absolute views on both ends of the spectrum. There are people that believe that the society should be opened up now. You saw some of the protesters in different state capitals around the country. And you have a group of people who believe that the society should be shut down, shut those parks down, shut down any place where any number of people can come together. Both of those two extreme points of view have their adherents, and everybody's entitled to their opinion. It's not for me to say, you don't have the right to hold that position. You hold that position. It's a democracy. I don't think you're right. In my opinion, I think it is almost always a balancing act of moderation, and frankly, in almost every issue. Look at the actual facts on the ground. Don't look at the number of cars in the parking lot, or don't look at a park for the 10 minutes where you may see this happening. Look at it over the sweep of the day. Because if you're going to shut the park down on one end of it, then you're going to ruin that experience for 85% of the people that are following the rules. The real question is, how do you enforce the rules for the 15% that aren't? When you pass by and you think you see this clustering, you might see it at a golf course, and you think it's wrong, that's the point in time at which we have to break it up. not you extrapolate that moment to shut the park down in its entirety or shut the plaza down in its entirety. At the other end of the spectrum, I've been critical of people that say, just open it up, let them rip. Well, it may not be as much as at a park, but I have been very clear in talking about how reticent I am to open public pools, beaches, and playland amusement park. Why? Because I can envision how you could walk around Kensico Dam and socially distance yourself and wear a mask and not be in each other's place. The place is large enough for people to give each other fair clearance. But when you talk about a beach on a hot sunny day and everybody wants to be in the water, kids don't go in the water and socially distance. They have to be trained to do that. They're going to play with each other. They're going to come in contact with other kids. And that will be true of people of a variety of different ages. So it is, in my judgment, and I understand it's a personal judgment, but in essence, when you elect officials, that's what you do. It's a representative form of government. I represent you. I may not represent your opinion on this particular issue. Maybe there are other issues that you agree with me on, or I agree with you on, however you want to frame it. But I have to make decisions not just based on what I think the world should look like. I have to do it on the basis of the largest possible base of situations. Now, you might look at a golf course and say, well, those people shouldn't be out on the golf course. They're advancing the virus. Well, that may be true, but I will tell you what's far more of a problem are people who live in an urban setting in multifamily apartment buildings. They have no green space to go in. They are just not going to stay in their apartment for 2 straight weeks or for 2 straight months. They're not going to do it. They're going to be outside and they're going to be out in the streets, clustered around the entrances of an apartment building, clustered around the little swing set in the asphalt playground that's right there. That's where the virus is going to spread more quickly. So you have to give people legitimate alternatives. If you close all the parks, which some people want to, they get a couple of, medical professionals, got to close all the parks, got to shut it all down. You then have to have a policing problem like you can't imagine to try to keep people in their apartments all the time because you haven't given them an alternative. You haven't given them a spacious alternative where they can go and exercise and stretch out, and yet at the same time not social distance. So it's foolish to just take an absolutist position. On the other side of the coin, the absolute, let's open up the tattoo parlors and let's go. That to me is foolish as well. We haven't mastered the curve by any means. We're just now starting to come down. And we got here, and the governor made this point earlier today, so I'm not saying anything you haven't heard before. We got to this point by all the discipline that we've shown, and you're going to throw it away. I'll give you a ridiculous example. I have a weight problem. I can be good from the beginning of the morning until 9 o'clock at night. And at 9 o'clock at night, if I have a big fat dessert, a big fat piece of cake, I have ruined the sacrifice all day long of watching what I eat and being careful and not consuming too much. And that's the same mindset if you open up prematurely. You've shown discipline and stamina to this point, and now because some people philosophically believe it's my right to go what I want, I'll take my risk of health. Yeah, except that your risk risks somebody else's health. So I will argue vociferously time and time again that both extremes are wrong. An absolute shutdown of the society does not take into account the reality of American people and American philosophy and American society. You will not be able to shut it down to the degree that you want to. So you must have some acceptable ways to let the pressure valve off. And those parks and those little recreational areas, properly controlled, represent that safety valve. And at the other end of the spectrum, you can't just let it all rip. Because if you do, you're going to have crowded places of business, crowded places of recreation, well beyond what you control. No one's going to wear a mask. No one's going to socially distance. So I'm going to argue within the context of what I believe that there's a moderate way to do this, and it's an intelligent way. And by the way, it's proving to be the right strategy. We have kept Kensico Dam Plaza open. We have kept and restarted some of our golf courses, having had them on long, and we're coming down with a moderate, intelligent, inclusive strategy. And as many people as come up to me insistent on either extreme, I argue back. What we're doing is working. Westchester County has tested more people percentage-wise than any other jurisdiction in New York State. Perhaps, I don't know, the whole United States, but in a significant portion of the United States. The moderate view is allowing people a chance to let off some of the steam that they need to do it in an appropriate way. But at the same time, in a controlled environment that doesn't let all heck break loose. And that's steering the ship between two icebergs out there that I think some people are more willing to steer closer to one or the other strategy. And I think that is it's a long answer for a simple question, but I think it's important to understand what the thinking is behind the strategy. It's not a mindless keep it open, close it.
Okay, that was the last question.
That was the last question. Well, and I guess I don't feel too guilty for over answering it. This is our Tuesday report tomorrow. We'll be back on Facebook Live at 11 o'clock today. Ken Jenkins was on interviewing Jan Fisher. If you did not see it live, you can look for it on our Westchester County Government Facebook page. And our Deputy County Executive did a fine job talking to Jan Fisher, who's head of nonprofit Westchester. And you can take a look at that. If you're in the household day, it's a beautiful day, but if you're in the household day, you might as well find something of interest to look at. Tomorrow, I'll be back on Facebook Live at 11 o'clock, and then we will have our 2 o'clock update as we go forward. I should mention one other point of fact that I didn't include in my general overview, the generosity of Hanes Brands Incorporated. You may know Hanes as underwear apparel makers. They have donated 300,000, that's a huge number, 300,000 face masks that they manufactured, and they have given those to the state, to Westchester County for distribution. We thought that the smartest way to distribute it is through the local cities, towns, and villages. And so we have allocated boxes of that to each of our 45 municipalities so that they could then redistribute them in whatever way they want to the local chamber, through the local chamber of commerce, to the local community organizations that serve their area. Just today, I was in my home community of Rise City with the mayor and members of the city council, delivering a certain number of boxes there. And we've done it for a number of communities so far. Most all of them have them now, but we went out to make the symbolic transfer. Tomorrow will be in, I believe, Ossining and Peekskill, maybe Pleasantville as well, to complete that project. Whenever we get that type of generosity, number one, we want to thank the organization, in this case, Hanes Brands Incorporated, for the generosity. We thank the state for being a partner in making this happen. Our people who work in emergency services at the warehouse, they have a shipping dock like any corporation would, any business would. They do a great job of moving out the product. And as additional product comes in donated, we'll do our very best to get it out in the hands of the people that need it the most. I'm George Latimer. Thanks for watching. Have a good day. Stay safe.